Here we go. Welcome to Secondary Traumatic Stress and Self-Care. My name is Bobbi Beale. I'm a clinical psychologist, and I'm with the Center for Innovative Practices. Secondary traumatic stress, or the presence of PTSD symptoms due to exposure to other people's traumatic experience, is arguably the biggest threat to the well-being of our workforce. After a quick review of secondary traumatic stress, we'll explore some self-care strategies that can keep us strong. First, we need to understand that our social service workforce, all of them, are likely to have higher rates of primary trauma than the general workforce. So we show up as staff and program workers with more trauma already experienced under our belt than out in the more general public. And if you think about why, I want to tell you that a large percentage of our workforce is trying to fix the problem they know all too well. They want to make it better, they want to stop it from happening to others, and they want to give back. And then they start collecting secondary traumatic stress that gets added on to their own trauma. And because honestly, we're all hearing about other people's trauma all the time. As a matter of fact, when we hear a case presentation today, there's likely to be some trauma mentioned. And that's not unusual with any of the youth that are served in any of our systems. So this is the definition of secondary traumatic stress. It's emotional duress that results when an individual is exposed to the firsthand trauma experiences of other people. So who exactly is at risk for secondary traumatic stress? Well, child welfare workers are at the top of the list. Therapists, counselors, and general social workers also up there. And if you're very empathic, if you're a feeling person and you feel for other people, you're at risk for secondary traumatic stress. If you have your own unresolved personal trauma, you're at a higher risk for secondary traumatic stress. If you carry a heavy or only trauma caseload, you're at risk. And if you feel socially or organizationally isolated, if you don't feel like you have a good support network that you can count on, that increases your risk. And finally, inadequate training, not understanding things about trauma and secondary traumatic stress and what we can do about it. So, who's at risk for secondary traumatic stress? You are. Here's a list of common stress symptoms. These symptoms are important. These problems that people have, we talk about people having stress or trauma symptoms, but they extend beyond just having these individual symptoms themselves. When you have a bunch of these symptoms, and I want you to think about it, I threw 16 up there. There are more, but I threw 16 up there, and do a count in your head. How many of these symptoms have you experienced in the last 30 days? When we have these sorts of symptoms, it's possible that client care is compromised. It's possible that you feel less effective in your work. And secondary traumatic stress predicts who will leave the field. And boy, we're having a significant amount of turnover, and if not people leaving, then shuffling about trying to find a better fit. So we need to remember that secondary traumatic stress symptoms are legitimate PTSD symptoms. Just because they're called secondary doesn't mean that they're like less painful, less disruptive, or lesser in any way. These are legitimately symptoms that could be diagnosed, so we have to take them seriously. Trauma-informed care applies to secondary traumatic stress. If we agree that secondary traumatic stress is a legitimate trauma for our workforce, then trauma-informed care is at least part of the answer. So we're going to take a quick peek at SAMHSA's 4 R's for trauma-informed care. The first one is to realize the widespread impact of trauma. And I'm telling you, it's everywhere these days, and a huge portion of people experience enough trauma to have some of the symptoms that we just looked at, and that it can affect anyone really. I do like the last part of this statement though. Understand the potential paths for recovery. As a psychologist working in the behavioral health field, I think therapy is a great option. But you probably know that only 25% of the people who could have a legitimate diagnosis and get services, therapeutic services, only 25% of them actually show up for therapy or stick with more than one session. So there are other paths for recovery, and they include all sorts of things that fall in that self-care category. Some people find some relief and eventual recovery from exercising, from praying or meditating, from connecting with friends and family, from being in nature. So there are lots of paths for recovery. Next, we want to recognize the signs and symptoms of trauma in clients, in families, in our staff, and with anyone involved in any of our systems. And I like to say that the easiest way to recognize trauma symptoms is to look for an overreaction, something that just is bigger than you expected, and it doesn't seem to fit the current situation. It's probably triggering trauma memories and responses in the present moment. And remember, this isn't just about clients, it's about all of us. Next, the next R is respond, and we want to respond fully by integrating all of our knowledge about trauma into the policies, procedures, and practices at our organizations. And finally, the last R is resist. Resist re-traumatization. So a lot of times when people have trauma reactions, they're not behaving well. The behavior looks bad if we were just to rank order it. They are probably being aggressive or impulsive or self-centered. And we can all fall into that occasionally. But our tendency is to try to squash that behavior, which does not make people feel safe if they're being punished or they can tell that people don't like what they're doing. And so somehow that's how we have to shift our responses, is to move into helping people feel safe and supported instead of just identifying what they're doing wrong and outlawing it, saying you can't behave that way, which is a lot of how we treat children who have big responses. Next, how can you identify secondary traumatic stress and we're really talking about in the workplace. There are 3 different things on the screen, and that will help us see our colleagues and the symptoms of secondary traumatic stress. The first one is an informal self-assessment. It helps to clarify your own trauma history. What kind of exposure do you have? What kind of emotional relationship with work do you have? Do you dread it? Do you love it? Do you sway back and forth? And what are the symptoms you have from doing that kind of work? So this is just informal, you thinking about these things. The next one is reflective supervision models. And that's when the supervisor takes the time to be attentive to the emotional content and the worker's responses. So as supervisors, we're often all about the paperwork, the reports that are due, how many clients did you see? Are you meeting your productivity hours? Have you visited all of your families? Those sorts of things, which is fine. And you're responsible to do so as a supervisor. But if you use a reflective supervision model, you really spend the first 5 to 10 minutes of your time with an employee checking in, seeing how they are emotionally and how they're feeling about the work. This does not mean we avoid the rest of the work. It just means connection first. And the third one is formal assessment. You can do some sort of formal assessment at regular intervals to track changes. And I heavily recommend the ProQoL, PROQOL. It's free, it's online, and it's a measurement of the things we're talking about. So These are all strategies to prevent secondary traumatic stress. And you can read them up there yourselves. These are all things that would be helpful if we had the time and energy to put into it. And not all things are helpful to all people. You sort of have to figure out what works for different people. I'm going to go on because I know I only have a few more minutes here. The other part of trauma-informed care are SAMHSA's 6 guiding principles. They center around those 4 R's: to realize, recognize, respond, and resist. But these are the things that they want us to understand as core principles for trauma-informed care: safety, trust, peer support, collaboration and mutuality, having voice and choice, and cultural, historic, and gender issues. So these are the things that we want to keep in mind when we're dealing with both clients with trauma and also each other. You can learn about the 6 core areas that address the biology of toxic stress from Nadine Burke Harris. That's, and her name's down here on the bottom on that book. She wrote this book called The Deepest Well. It's excellent. If you do books by listening, she's the reader. And this is Dr. Harris right here. And she really worked hard to uncover these 6 areas. First of all, sleep, critically important. It's when your brain sort of sorts things out and orders them for you. Exercise, or just moving your body, also helpful. Of course, your parents, your grandparents, people have told you your whole life, you eat healthy, and that's helpful as well. Having some sort of mindfulness practice, taking care of your mental health when you find yourself recognizing that you have some stress or some feelings or some behaviors around these issues, and having healthy relationships. So all this leads to self-care and self-compassion. This is about you taking care of yourself. It's related to that old saying about needing to put on your own oxygen mask first, and then you can actually help others. The more we care for ourselves, the more we're available for others. So here, I just reiterate Nadine Burke Harris's 6 concepts, and I remind you that we should all be getting enough sleep. Turn off your screens, avoid social media, wind down, and try to get those 7 to 9 hours every night. Next, you should be moving your body every day. A lot of people say, I can't move my body, I have these aches and pains. I'm telling you, you have aches and pains because you're not moving your body enough. Your body was designed to move, so find some way to move. It doesn't matter how. Stretching, doing yoga, doing workouts, taking a daily walk, those sorts of things, but move every day. Eat a little bit healthier. Don't beat yourself up for not eating perfectly or for not always eating only the healthy things. Just try to add one healthy thing into your diet. Have one extra fruit or one extra vegetable each day. You should practice some sort of mindfulness, but you have a lot of options here. Meditate, journal, gratitude practices, positive intentions, and even prayer, if that's your go-to. That's a version of mindfulness, and everybody should take. Oh, and by the way, you don't have to do it for hours every day. A lot of times, 10 to 12 minutes is a sufficient amount of mindfulness practice to make a difference. Protect your own mental health and increase your own resiliency and protective factors. And finally, those healthy relationships. You all deserve to love and be loved, as do all the humans. And so remember, folks, self-care isn't a luxury or a weakness. It's a requirement. It's a requirement for our own health outcomes and a gift to the world if you're serving other people. So try some of these things on. I'll wrap it up with 4 quick things that you can do when you feel anxious or agitated or somehow not as focused. Hit pause and tune into your body. How do you feel? Don't try to control it, but be curious. It's going to give you options. Next, take a breath, a nice deep breath with a long, slow exhale. And that is going to activate your parasympathetic nervous system, which is always helpful. And here's a bonus. Go help somebody. Feeling out of sorts? Find somebody to assist just for a few minutes. And it's like a double shot of dopamine because they're going to have some dopamine released in their brain because you're taking time to help them, and you're going to have dopamine in your brain. It's a feel-good neurotransmitter because you feel helpful. And finally, shake it off. I've in the past done a big shake activity with this group, but if you can shake, 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 and put on a song, a 2 or 3 minute song, and dance and shake for 2 minutes, you release stress with that activity. And I did it. There's one more slide here, and it's resilience planning. And there's a handout in the new platform, the ECHO platform, that has all of these slides in it, and you can check those out. But I want to thank you for your attention, and remember, it benefits all of us if we're trauma informed.